Hello, class. My name is Benjamin Grounds, and the title of the article that I have chosen is The Journey of Discovering Compassionate Listening by Peter Kimball, RN, MA, and Anita Bamford Wade, RN, MAD Nurse. I chose this article because it presents a first-hand look at how important the skill of listening is in healthcare and how the combination of compassion and listening can truly impact the patient's experience while receiving treatment. This article directly relates to Chapter 8 of our textbook in that they both present the idea and the significance of listening attentively to the patient. The purpose of this article is to discuss the significance of compassionate listening in healthcare. Authors Kimball and Bamford Wade have extensive experience working as nurses, and they use their experience, expertise, and compassion to help them become better healthcare providers. This article presents several instances in which compassionate listening created an optimal healthcare environment. Both authors share stories of how being compassionate and listening attentively to the patient or to the family of the patient truly changed the patient experience. The authors realize that compassionate listening is crucial to providing effective and impactful healthcare. Therefore, they present their previous experience as evidence for the significance of compassionate listening in healthcare. The authors state that the most effective way to provide healthcare to individuals is to be compassionate towards them and to listen carefully to their concerns. The authors state that having compassion means to have the ability to understand and to see the suffering or the unique situation in which another human being is in. And after explaining the definition of compassion, the authors discuss the meaning of compassionate listening. Compassionate listening is a form of active listening that involves the ability to be present or to be attentive towards another person. Through compassionate listening, the authors state that the true power of healthcare can be seen. This article does a superb job of presenting the idea of compassionate listening, and the authors do an excellent job of presenting information about situations in which compassionate listening changed and bettered the healthcare being provided. The biggest critique I have for the article is its lack of quantitative data. The authors use emotional statements and heartfelt stories to present their case for the significance of compassionate listening, but they provide little to almost no scientific data to support their claim. As a healthcare professional myself, I tend to agree with them on the significance of compassionate listening, but as an unbiased reader, I am less convinced due to the lack of support that they provide within the article. An area in which the article excels is the way in which it forces the reader to think hard and reflect on his or her decisions. The authors frequently ask rhetorical questions that are aimed to cause the reader to stop and think about the way in which they might have handled the situation. This is a brilliant way in which the authors really bring the reader into their discussion and challenge them to reflect on similar situations. Similar to how the authors use questions to bring their audience in and persuade them to agree with their ideas, I have come up with 3 questions that I hope will motivate you to think about your current listening and compassion skills and hopefully improve upon them. Question number 1. After having a conversation with a patient, coworker, friend, or acquaintance, how often can you restate the conversation, including the part spoken by the other party, in full, with clarity, and without missing any information? Question 2. After having a conversation with a patient, coworker, friend, or acquaintance, how often can you relate on an emotional level and truly feel compassionate towards the person in which you are talking? And question number 3. After having a conversation with a patient, coworker, friend, or acquaintance, how often have you made that person feel more at ease and at peace with the results of whatever issue he or she may be having? In conclusion, the article, The Journey of Discovering Compassionate Listening, presents the benefits of compassionate listening in healthcare. Compassionate listening should be practiced by all healthcare professionals because of the increased level of care provided. Compassionate listening elevates the level of care towards the patient by allowing the patient to be fully heard by the healthcare provider. Thank you.